President Obama canceled a trip to Asia as a 16-month battle prepares to come to an end. A vote could come as soon as Sunday.
The vote that's taken in the House will be a vote for health care reform, and if people vote yes, whatever form that takes, that is going to be a vote for health care reform, and I don't think we should pretend otherwise.
Joining me this morning is Democratic Congressman Anthony Weiner, representing Queens and Brooklyn, and in Washington, D.C. right now, Republican Congressman Scott Garrett, representing several northern New Jersey counties. Thank you so much, gentlemen, for being with me. Congressman Weiner, let's start with you. You're in town because you're testing or taking the temperature of the people in your community, and what did you find last night?
Well, look, I've done 16 town hall meetings about this, and I've kind of been leading with my chin on health care last year or so. You know, we've gone through that period where people were angry to now people just want to understand the bill. And for New York, it means a lot. I was in Queens last night. 3 hospitals in Queens have closed in the last year and a half because so many uninsured people are coming into the hospitals, they can't afford to pay for it. We in the city of New York this year are going to pay $8 billion in taxes for the uninsured and the underinsured. So we need to solve this problem, and that's what the bill does. It really helps out New York City.
Congressman Garrett, do you feel that this is good for our area, this health care bill?
No, I don't think it's good for our area, and the people from the area don't think it as well. I mean, my constituents are calling me and saying vote no. Matter of fact, people from Anthony's districts in New York are calling me and say voting no. You know, Anthony was on the floor last night, and I heard him say he's going up to New York today because he says people are going to scream at him there to vote no, and then he's going to be able to go on later on and say he's listening to the people. And still, obviously, at the end of the day, I bet you, Anthony, you'll be voting yes on this bill, despite the fact that your constituents are saying no, no, no.
Is that true?
They do not want this bill to pass.
Well, perhaps the last person I'll listen to about my constituents is Congressman Garrett. He's a good man, but he doesn't know what he's talking about. In fact, my constituents understand the economy is getting dragged down by all the uninsured people. And, you know, here's the problem. You know, that forum at the White House, going around the table, everyone agreed we had to solve this problem. But my Republican friends who are wholly owned subsidiaries of the insurance industry say do anything but don't touch the rates that we're paying. We want them to keep going up. The Democrats are doing what should have been done a long time ago, and unfortunately not a single Republican is going to do anything to reel in the health insurance industry, and that's the problem we have right now. That's why this vote is so close.
Congressman, do you think this is going to pass on Sunday? I mean, is there a possibility it doesn't?
Well, right now where we are is there is bipartisan opposition to this bill. From day one, there has been bipartisan opposition in the bill, and that's the reason why the Democrats, when they were in control of both the House and the Senate with a 60-vote majority in Senate, they couldn't get it done for over a year because they just couldn't get their own party together on this issue. So now they've missed every single line down the road. If the people that Anthony heard last night who were probably yelling at him and screaming at him, as he said last night on the floor, are saying no still, hopefully he and the rest of Congress will listen to him and say, we need to do just what was said at the White House, and that is to find some parts of this where there is bipartisan support for it and do things that actually will bring the cost curve of health care down so people once again can afford their health insurance in this country.
Congressman Garrett makes some great points. I mean, and you feel it in your district right now. Are you concerned that if you vote yes, that you may pay for it at some point?
Oh, no. We're trying to solve problems here, and my constituents understand that. Look, there's no doubt about it. There has been a systematic disinformation campaign waged by many people about this bill. If you ask them, do you want your rates to go down, they say yes. Should we stop the insurance abuses, they say yes. You ask them, do we want to reduce the taxes paid in New York, they say yes.
But then why can't you get bipartisan support for this?
Because the Republicans have said, they've said themselves they want this to fail because they say they want it to be here.
Democrats in your own party.
Well, you just said, why don't we get Republicans to do it?
Okay,
let me do one question at a time. Let me do the Republicans
okay.
first. First, Republicans have said they think this is President Obama's Waterloo. They want him to fail because they're putting politics ahead of the public.
But what do you say about the people in your own party?
We have
not supporting
of
this
our Democrats, we have 258. We now have 250 or something, 230, whatever it is. We by and large we're together on it. This is
difficult.
But are you
buying their votes? Because a lot of them are getting, you know, nice little cushy deals.
First of all, I got to tell you something. I love the cliche, but it's not true. You know, I don't believe that members of Congress are getting bought for their votes. They're waiting to see things like we got yesterday. The CBO score saves $1.2 trillion for the taxpayer. They're waiting to see the bill so I can make sure that New York City was protected. So this idea of being bought off, I know it makes for a good story, but in fact, sometimes legislation is just a philosophical thing. The Republicans philosophically believe their job is to protect the insurance industry. We philosophically believe our job is to protect citizens. That's why this bill is going to become law.
Congressman Garrett, let me ask you something.
Come on.
Will people in the...
Let me
okay, go ahead. I know that you're chomping at the bit to say something.
Well, Anthony, you got to listen to your own president on this. Even your own president says that he doesn't like the special sweetheart deals that are put in this bill, and those special deals.
Vote for reconciliation. We're taking them out.
No, they're not being taken out. Come on, you've got to admit this. Come on, the facts are the facts. We're looking at a 2,500-page bill. Those deals are still in this bill, and they're still there. And those deals were cut by your party with your members in order to get their votes in the House. Those deals, almost all those.
If you're against the Nebraska deal, you have to vote. If you're against the Nebraska deal, you have to vote for reconciliation to take it out. Are you going to vote for that? No, you're going to vote to keep it in by voting no on reconciliation. That's just phony.
But listen, the President of the United States realizes what's on the line here. He's not even that confident that he can go away to Asia right now before this vote is taken. He knows things are a little shaky.
100%. We're not getting a single Republican vote to reel in the insurance industry. So it's going to be tough.
Well, let me ask you something. Will you opt in for this insurance plan? I mean,
my goodness.
Will you personally give up the gold card insurance plan that you have right now?
You know, I got to tell you, there's so many straw men in that question, I don't know where to start. I get the same insurance as every federal employee, from the janitor to the President of the United States.
Well, will you opt out of that?
Secondly, no one can opt into the exchange except if they're uninsured. That's the way the bill is written. I would love it. I would love to have Medicare, for example. I think all Americans should get access to Medicare. 150 members of Congress, I would love to do it. Unfortunately, the bill to protect the insurance industry, to protect it, only the uninsured are going to be moving into this exchange. But I would absolutely, we want to get all Americans the type of choices we have.
Congressman Garrett, let me ask you something. I mean, in the Kennedy health fair, right? In the Kennedy health bill, didn't they get the exemption that Congress is exempt from this health care plan, Congressman Garrett?
We have tried repeatedly to do just what you're saying here, is to say that Congress should be in the same plan as the American public, and every time, just about every single time the Republicans put that out, guess what happens? The Democrats vote that down.
What do you mean the plan of the American public? What does that even mean? What do you mean the plan for the American public?
What you mean is what you just said. You said if you didn't have insurance, then you would be in the same boat as those people who have to go into exchange. So, Anthony, if those people who don't have insurance have to go into exchange, why don't you say into the bill, take out any exemption for Congress, and say
there's no exemption for Congress. You and I we're giving the American people what you and I get.
So, no.
100%. They're getting an exchange just like we're in. I got to tell you something. Of all the people who can't make this argument, you can't. You certainly can't make this argument, because you know what we get is essentially an exchange, the same that's in the bill. And this whole notion, gold-plated stuff that Congress gets, you've got to stop believing the lies that are out there about this bill. In fact, I want all Americans to be able to get into the exchange if I could. Right now, it's only for the uninsured.
Congressman Garrett?
Ask your constituents. Go to one of those town meetings that you were talking about.
I went last night, Scott.
Ask them, I know, well, that's great. And ask them to say, here's a list of all of my benefits, and here's a list of all of my coverage. How many people in the room get the same coverage?
Well, I'm going to tell you something. My constituents understand that we, the taxpayers, are the employer for every federal employee, every state employee, every state retiree. When all of these rates go up and up, who pays for it? Right. We do. The taxpayers do. We need those to come down. And while your party is fighting to protect the health insurance industry, we're trying to bring them down. Can you point to a single vote that the Republicans have taken to reel in the insurance industry? A single one. Thank you.
Well, you will not let any of our bills come up, will you?
We've had. Listen, I've heard you just got done saying we spent a year working on this bill. What, were your guys all absent from committee?
All right, Congressman.
Oh no, we put up 100. We put up 100 amendments.
Many of them are in the bill. Some of the worst elements of this bill you guys put in.
Obviously, this is a hot button issue, Congressman Weiner, Congressman Garrett from D.C. Thank you so much. We'll see what happens on Sunday. You're confident that it's gonna pass?
Confidence is a strong word. All right. I'm hopeful.
Hopeful. There you go. All right. Thank you so much for being here. Harry, over to you.
Spirited and lively debate this morning. Thanks very much.